Hello and welcome to this evening's webinar, Opening the Door, How the GP Can Facilitate Conversations with Patients Facing Gambling Harm. My name is Claire Pearson and I'm the Education and Events Officer for the Specific Interest Faculty, and I'll be your host for this evening. So where is my control panel? So just some quick housekeeping notes before we begin tonight. So your control panel will appear as the bar at the bottom of the presentation screen. If you don't see that bar, just hover your mouse over the bottom and it will pop up. So your control panel means that you can do your settings for this evening. You can also use our Q&A box, and it's a way you can interact with your peers this evening. And this webinar, just a reminder, is worth 2 CPD points, which we'll be uploading for you within the next 30 days. And a quick introduction to our presenters this evening. So we have Dr. Hester Wilson. She's our chair of the RSEGP Addiction Medicine Specific Interest Group. And we have Dr. Kate Fennessy. She's the senior clinical psychologist and clinical lead at Gamble Aware for South Eastern Sydney. So I'll now pass over the presentation to Dr. Hester Wilson for our acknowledgement of country.
Thank you so much, Claire. I would like to acknowledge the traditional owners of the country on which you are and I am on. I'm on the Gadigal people of the Eora Nation in Sydney, and I wish to pay my respects to elders past, present and emerging, and any Aboriginal and Torres Strait Islander people who are with us here tonight. Next slide, please. So learning outcomes. So this webinar is Opening the Door, how GPs can facilitate conversations with patients around gambling harm. So we've done previous webinars that have looked at, what is gambling? How do you screen? And this one's going to dive a bit more deeply into what we can do in our general practice setting. So initiating conversations, investigating the potential harms and the stage of change that our patients are in, motivational interviewing techniques. We're going to demonstrate some of those that can help the patient to mitigate their harms, techniques to create a safe therapeutic environment and communications with the patient, and management strategies for a person with problem gambling, and the options of specialist care. Thank you so much. Next slide. So this is just a quick reframe of what we've done in the previous webinars, that screening. For me, I do a lot of addiction stuff, and I think I've probably not been very good at thinking about gambling in my patients, and it is unfortunately common. So really encouraging you to think in your work, in your clinic, in your surgery, to think about who would you ask about gambling and how you ask. Asking it as part of your lifestyle review. Do you gamble? Sometimes people turn to drugs, alcohol, or gambling as a way of coping. So if you're seeing someone who's a bit stressed or has some mental health issues, would you say any of these negative affect you or your family? Do you have any concerns or things that negatively affect you, such as gambling? In the past 12 months, have you had an issue with gambling? So just thinking of those different ways you can just screen and check in with your patients to see if there is an issue with gambling. Next slide. Reminding you guys about the cycle of change, the Prochaska and De Clementi, pre-contemplative, contemplative, preparation, action, maintenance, and potentially lapsing or relapsing back into the old behaviour. I'm sure most of us have heard of this. We're going to just very briefly go through it because it's important as you're talking to someone, to just suss where they are, because that changes the conversation. Next slide. So, quick polls for you guys. This is Joe, who says, look, doc, I've been thinking about stopping gambling and I've decided that I need to do this now. Where do you think Joe is? Can we get the poll up? Is Joe pre-contemplative, contemplative, in preparation, action, maintenance, or relapse stage? So if you guys can just fill that in super quick. We're getting the answers up. Okay, so pre-contemplative, contemplative, preparation, action. So I've been thinking about gambling and I've decided that I need to do this now. Probably from my point of view, and Kate, I'll bring you in and if you want to turn your camera on. I would say that with this one, I've been thinking about it and I've decided I need to do this now is preparation, action. Would you agree?
Hi everyone, thanks for having me. I think that I would place him at preparation and action. Yeah, I think you're right.
Fantastic. Let's move on to the next one. Joe says, look, doc, I know I should stop gambling, but I really love it. And last week I won 240 bucks. Put the poll up. Where do you think he would be? Pre-contemplative, contemplative, preparing for action, taking action, maintaining that change, or relapsing. And see what the answers are. Pre-contemplative. Maintenance is kind of he's maintaining his gambling. I guess when we're talking about maintenance, we're talking about change. And so we're not seeing someone here who's stopped gambling and has continued to stop gambling or has decreased their harm. Could possibly be relapse. I think you're right. It is pre-contemplative, but there is that little note there of I know I should, and so maybe there's a conversation that can happen there. Moving on to the next one. Look, doc, I used to gamble a lot when I was younger. I've changed this and I haven't gambled for a long time. However, since I lost my job, things have been tight and I've been gambling again. Where do you think this person is in their stage of change? Are they not thinking about change? Are they contemplating change, preparing to make that change, taking action to make that change, maintaining the change they've made, or relapsing back to an old behaviour? And relapse. Yeah. So I would agree that it's relapse. Pre-contemplative, contemplative preparation. What do you think about those, Kate, as options with what Joe's said? I mean, we only know a little bit of Joe's story, but where would you put him?
I think that's it, in that, you know, this patient could be in any of the stages of change and be saying things like that. But I think just based on what we know, I'd put him in relapse. That he has made lots of attempts to step away from it, and he's fallen back into old patterns.
Yeah. Okay. Next one. Look, doc, my wife is concerned about my gambling and I know it upsets her. I really like it. I'm not sure I want to change. Where would you put him? Not thinking about change, preparing for change, taking action to make the change, maintaining the change that they've made, or relapsing back to old habits. Where are we with this one? Waiting for the answers. Pre-contemplative, contemplative, preparation, action, maintenance. I would say for him, I know it upsets her, but I really like it. I'm not sure I want to change. Pre-contemplative, contemplative. What would you say, Kate?
I would probably say that this person is pre-contemplative. However, because it's in the conversation with you, then perhaps there is a window there to work on the motivation. The motivation might be that he doesn't want to keep upsetting his wife, for example, not necessarily to stop gambling.
Exactly. Okay, moving on to the next. So this is just a rejig of this. Kate, do you want to speak to this slide? Just think we've been through those stages of change and looking at what are the tasks that we do depending on the stage of change.
Well, I thank you, Hester. I think that just typifies how tricky it can be to hear that language of change and to really place people. But it is something good to refresh, I think, in our practice, because we know that attuning to where the patient is at in that cycle of change, which is actually a movable feast. You know, in a conversation, somebody could switch from pre-contemplation to action, and between consultations, they can switch right back again or be in relapse. So attuning as much as we can. If we're too far ahead in that cycle for the patient, for example, if they're saying, you know, I don't think this is a problem for me, and you're thinking, look, you need to tell your wife, ban yourself from the venue, cut up your credit card, whatever it might be, your patient is probably not going to be able to hear you and possibly not going to be able to make that change. So attuning is important. Similarly, if you're too far behind and the patient is saying, what do I do? I'm ready. I'm sick of this gambling. And you're saying, let's do out a pros and cons list. What do you think? You know, again, you're too far behind and you're mistuning with the patient, and you're missing that golden opportunity of a motivational window to make changes there. So this is actually quite a freely available bit of information, and I think one of the places that this is available is on the RACGP website, where it really talks to what the clinician ideally is doing as they are moving through different stages with their patients.
Fantastic. Moving on to the next slide. So case study. Now we're going to come back to this. Oh, am I? No?
Just
Can you
came
hear me?
through.
Okay,
Yeah.
sorry guys. Yeah, so this is a case study. I'm just going to quickly introduce it now and then we'll come back to it because we're going to do a role play with our expert, Dr. Kate, showing us how to do motivational interviewing in our setting. So Joanne's a 49-year-old woman. At her last visit, she came in and saw us and asked for help with a low mood. As part of the assessment, asked about gambling. She disclosed that she was worried about her gambling and that she thought she might need help. Her husband was upset with her and they had financial problems as a result of her gambling. You explained that this issue was important, but unfortunately, because she'd only booked a 15-minute appointment and your waiting room is full, it's not something you could do in that last conversation, in that last appointment. But you said, look, hey, this is important. I really want to help you. We need more time because this is really important. Let's make another appointment. So she's going to come back and talk to you about that. So what we wanted to do now is move on for Kate to talk to some of the things that you might do with Joanne to help her and to help you begin this process of changing.
Thanks, Esther. So as we talk about motivational interviewing together, I think one of the main reactions that I usually get is that a lot of this is going to be very familiar to you because you already do this. This is an approach which is collaborative, where you're meeting the patient sort of as equals, I suppose, or on an even footing, where you, the medical expert, is meeting with an expert in their aspirations, their fears, their goals, what's holding them back, what changes they wish to make in life. And I suppose motivational interviewing comes into its fore when patients are ambivalent. And what I mean by that, it's not something to be pathologized. It's a natural human condition where, for example, I think one way about something, I think another way about something, I don't want to think about that thing anymore. I stop thinking about that thing and I do nothing. And so I know in my own personal life and in my clinical work that that's a common condition. And we certainly see that in our patients as they come through. Change is difficult. And sometimes, particularly with addiction, people can spend a very long time in that state of ambivalence, which can be quite uncomfortable. And they can spend a very long time, I think it's around about 10 years in pre-contemplation before accessing specialist care sometimes. So, motivational interviewing is not for every situation. It's not for every clinician. So please take what you will from this. But it comes to its fore, as I said, when ambivalence shows its head, and that is usually in situations where there's a disconnect between short-term goals and long-term health outcomes or long-term goals. So, ambivalence is important. It's an important part of change, but ideally motivational interviewing can help your patients to resolve that ambivalence and move forward in their life. I suppose one of the ways in which we do that is by making room for people being in two minds. Some of these concepts, as we talk them through, might seem quite simple, like simplistic language. It's actually quite difficult, as we all know in our clinical practice, to do that. And these things look quite linear when I put them in a slideshow. However, we know that change is not a linear process and motivation waxes and wanes. So very briefly, I wanted to just touch upon a few theoretical bases of motivational interviewing. Miller and Rolnick are two clinical psychologists that help to define motivational interviewing. And I just wanted to briefly share this quote, that people are always motivated for something. Conflict arises when two people are motivated towards different goals. These two people may be a doctor and a patient, for example, or a counsellor and a client. When such conflict arises, one person may think of the other as being poorly motivated. Sometimes we'll happen upon a patient who is perhaps resistant, or we label them as being resistant or poorly motivated, but it is true that people are motivated for something. They might just not be motivated to talk to you about their gambling problems, for example. And when we're meeting people, we're wanting to assess where they are in the stages of change, and we want to have a think together about their good reasons for changing. Do they have goals? And Miller and Rolnick really talk to the concept of patients being willing, ready, and able. And when those boxes are ticked, then you can move to action. And you're all experts in, behavior change planning. So motivational interviewing is more for that ambivalent stage. Next slide, please. So when you're meeting with a patient who is ambivalent, you might be noticing that the conversation becomes a little stuck. You might make the case for change. You might find that they make the case for staying the same and all the reasons why that won't work. You might find that your conversation kind of goes around in a circle or doesn't really, they withdraw. They're all clues that perhaps it's time to do something a little differently and use a motivational interviewing toolkit. When we're listening for the language of change, we're talking about I shan't, I won't, I can't. These are all the reasons why not. I might, I could, I should, I would, I may, I can, and I will. And so we're looking for, the can and will towards the end of, hopefully towards the end of our consultation about what steps that they think they will take. The next slide, please. So motivational interviewing has these 4 tenets that it rests upon, and they spell out the acronym RULE. The first one I think is the most important to look at, because us healthcare workers are kind of trained into, but also in everyday life, we're trained into putting the world right, so to speak. So jumping in, giving the correct information, fixing problems and problem solving. We're often in that doing mode. And resisting the righting reflex is actually asking us to do something a little differently. Not that we don't advise our patients, but more that we don't just jump in without thinking. Because as anyone who has a toddler knows, that when you do that and you start making the case for change, the patient might find themselves thinking or telling you all the reasons why things should stay the same or why that's not a good idea. So that's the R. The U is understanding the patient's own motivations. And in motivational interviewing, that's called evoking. So asking the patient what their top reasons are for making this change. That means that you're not actually volunteering your opinion again on what the reasons should be. And sometimes it can be quite tricky to not to be judging or letting judgment get in the way of what their reasons might be. So for example, somebody might have 4 kids that they're struggling to put food on the table because of their gambling, but their reason might be something completely different. So again, easier said than done. The L is listening with empathy, which can seem self-explanatory, but again, we're really holding that space. Sometimes it can be difficult, especially in addiction, to really have empathy for wherever that person is at that moment in time. Especially when people are lapsing and relapsing repeatedly, it can be difficult to understand. Gambling has its own special logic to it. So easier said than done. And the E is empowering the client, which essentially means that you're putting your strengths glasses on and seeing the strength and resilience in people and reflecting that back to them, cheerleading them where possible. Next slide, please. There are a few tools, and I've included some resources towards the end of this presentation for more information on some of the tips and tricks to the nitty-gritty of using motivational interviewing. One of my favorites, though, is this first one, which is a decisional balance sheet. And you might say to me that that's just a pros and cons list, and it is, but I think we can't forget the power of having conversations like this, where we are allowing space for what gambling, for example, gives that person. What are the upsides of gambling for that person? They might not have really ever thought things through or experienced themselves answering some of those questions. Oftentimes people don't have these types of conversations outside clinical spaces necessarily. So you want to have all 4 quadrants really, ideally, if you have time, which is what are the costs and benefits of changing, and what are the costs and benefits of staying the same. And I also like to do short-term and long-term. So for example, somebody might say the gambling in the short term gives them a thrill, and it's something to do, and there's the chance of winning money. And in the long term, it can be really tricky to think of what gambling gives them. So some of these conversations can be quite powerful, they can be confronting. And if you don't have much time, then they can also be condensed into one question, such as, what is gambling costing you really? That would be the one question. Similarly, with the second point there, collapsing time, if you continued on down this path for 2 years, 10 years, what do you think things will look like? What about changing? What will things look like then? And that gives you really important information about what scares them about changing and some of the barriers that stand in their way. For some people in addiction, the addiction has taken over a lot of their life, as you will have seen, and it's very difficult for people to really imagine their lives without it. That third point is really clarifying the big 4 factors through conversation. Why would you change? What are your good reasons for changing? What steps, if you're ready, would you take, and what might get in the way? And this is a classic motivational interviewing question. What do you think you'll do? Which is really empowering the patient, because we know that it's the patient who has to take the steps once they're out of your consultation rooms. Next slide, please. So these are some of the example questions that we've already spoken about. Sometimes it's good to sort of weight from 1 to 10, for example, how ready that the person feels, for example, so that you can get a guide and see if that changes over time. And as I said before, when the person is willing, ready, and able, then it's time to plan, to make pragmatic steps. Next slide, please. So these are some of the steps that we tend to support clients with gambling. I wanted to include this because it's all very well to be in action, but you sort of want to know what to do when that window of opportunity comes in. In gambling, you're often looking at stimulus control, as in what are some of the circumstances, either internally to the person or externally to the person, that leads to gambling urges or gambling behavior. So in gambling, that's often access to money, access to venues, which is listed as methods here, and the time that they're using to spend gambling. What else could they do with that time that's not compatible with gambling? I've also included good decisions, as in you want to be setting people up for success, to make clear decisions, and that might include things like steering clear of alcohol for the time being, or planning for risky events coming up where they would ordinarily be gambling. Next slide, please. So I've included some resources here. That final one is actually a very brief screening questionnaire based on 2 of the DSM-5 text revision criteria, and that is the LIBET test, which has very good psychometric properties actually for a 2-question questionnaire. The first one is, have you lied to people to conceal the extent of your gambling, and have you bet more than you've intended to? And if people answer yes to one of those, then they might need to be assessed for having a gambling problem. The others are some of the foundational texts for motivational interviewing from Miller and Rolnick. And I think later on, I've included links to some of the therapy manuals as well. Next slide, please. So Hester, Here we are at our role play. Yeah.
Here we are at the role play. So just go to the next slide. So once again, we're going to keep it on this slide because this is Joanne and I'm going to be Joanne, and Dr. Kate is going to be my GP. So what we want to do is we want to run through some of those tips and tricks and devices that Dr. Kate has already spoken about, and have a go at seeing. This is in the role play. We're putting both of us in the hot seat to do this in real time. Look, just to give you guys a bit of to see how you might do it if you're thinking, yeah, that's all very good, but how do I do it? We're going to be doing it in a 15-minute slot as well, to really, once again, that's the usual kind of time. It's 14 minutes is actually the average time that we spend with each patient in general practice. And just flagging that this is a specific appointment that Joanne has made, and that she's come back to see Dr. Kate because Dr. Kate was very good at supporting her, told her how important it was and that she wanted to really help her. So this is the start of the consultation. I'm just going to bring my cheat sheet across so I can see it.
Just as you do that, Hester, I forgot to say something earlier. Essentially, there's 4 steps to motivational interviewing. They're not linear. The first one is basically, shall we work together? So we've already done this with Joanne and I, and coming alongside the patient and seeing if we can find common ground. The second is focusing on what is the direction that we wish to work on, what is the change we wish to make. And I think that we've already established here with Joanne that gambling is the main issue in her life at the moment. The third one is evoking, which is, I think, unique to motivational interviewing, that language. And that's what I want us to be talking to today, is helping Joanne find her good reasons for making change. And then the fourth step is supporting them to make changes, which are all experts in, that step. So it's really that third one that we want to show today. So let's get into it. Sorry, Hester. So Joanne, thank you so much for coming back to see me today. We're wanting to talk about gambling because that's the main issue that you identified last time. That's the main issue in your life at the moment. Is that right?
Yeah. Look, I came to see you last time, and I'm just not sleeping in my mood. I just feel bad, and I'm arguing with my husband Clark, and I don't know.
Okay.
But I like playing the pokies, and yeah,
you know
I
what,
don't
Joanne, it's really, sorry to cut you off. It's really normal to be in two minds, like you're saying. You know, gambling obviously gives you something and obviously works for you. And if we don't make room to understand what it does give you, it can be really tricky to get any clarity about which direction you want to go in.
Yeah.
So,
yeah. Look, I feel like I should just be able to manage it myself, and I just feel shameful that I'm here.
And that's also really normal in gambling, is that actually you can set yourself up for an intention to do something or to change something and find yourself doing something quite different over and over and over again. So gambling, that's actually one of the effects potentially of having a gambling problem, is that, you know, it takes you quite far away from what's actually really important to you. So I wonder, Joanne, if you wouldn't mind if we try something together and we go through maybe a bit of a pros and cons list of the gambling for you, just to really see if we can help to clarify things. Is that okay?
Yeah, sure.
So I wonder if I can ask you what the gambling does give you. You know, what are some of the positives of it for you? You say you love it. Tell me more.
Yeah, and sometimes I win. Like that's just great. And when I was a kid, like my dad used to have a gamble, to bet on the horses, and you know, he'd take us down the track, and when he won, it was just so much fun, and he was so much fun, and you know, that winning is, and it's always just around the corner. There's a kind of an excitement or a thrill with it, but it's also that it makes me feel better when I'm a bit stressed.
Okay. Yep. Gambling does a very good job of that. So you've mentioned three things there. There's thrill, there's a rush there. There's also something familiar about it. You know, it's something that you experienced your dad seeing, and you saw your dad, you know, engaging in gambling, and there's something that's sort of pleasurable about that. And then it also just allows everything else to fade back into the background and allows you to get away from problems. Is that right?
Yeah, it's like nothing else matters, you know.
Oh,
and sorry.
Oh, and sorry, you mentioned as well that you have the possibility of winning money. So that's also something that gambling gives you in the short term, just that chance.
Look, money's always tight for us. And you know, but it is something that Clark and I argue about a bit, and it's just sitting at the pokies, all of that just falls away, and there's this possibility that I can change things and come home and just, you know, sort things out.
I think we do probably need to talk a bit more about how that works between the two of you, but certainly gambling seems like it might solve a problem, both by just alleviating that stress in the short term, but also it might actually present a solution by winning money. So what about in the long term, Joanne? What does gambling give you there, do you think? What are the upsides for staying gambling?
Look, if I won a whole heap of money, that'd be great. But I know what I've done in the past. I've won some money and then I put it straight back in because I think I'm going to win more.
That does tend to happen, doesn't it?
What does it do for me in the long term? That's the thing that I lie awake at night worrying about is, you know, how have I found myself here, and how, if I'm still doing this in 10 years' time?
Yeah, it can be very, very difficult to figure out. Sometimes the reasons why you started gambling might be really different from the reasons why you continue to do that. So what do you think the downsides are then, Joanne, of the gambling for you?
Wow, look, you know, I'm losing money. We're losing money as a family. It's causing arguments with Clark, and you know, I know I've gambled a lot of money. I try not to look. I don't want to know. I honestly don't want to know how much.
Don't want to add it up, yeah. But it is expensive, and it also creates conflict for the family and financial
Yeah.
stress, as you said
Yeah.
before.
Yeah.
Okay.
Yeah.
And what about in the long term? What do you think the downsides are in the long term? Is it much the same, or is there anything then if you continue to gamble for years to
Look,
come?
I think it's the same. The other thing is that, look, my dad, you know, he used to gamble, and I look back on that and I realise that mum often went without. She was pretty stoic and didn't talk much about it, but she went without.
Okay.
And he died of a heart attack, you know, in his early 50s. You know, and I've got a, you know, I've got the blood pressure and you know, the early diabetes, and you know, I don't know. I don't know if the gambling makes it worse, but certainly it feels like my stress does. So I just can't. It's just I just feel so stuck with it.
Yeah.
And then I'm
So
going to win, and it's going to be okay.
yes, I know. It's that
Crazy.
strange thing, isn't it, where gambling puts you in that position, but also presents a solution in a funny way. So there's also something there about maybe, you know, not having money to make better choices about health, or just being really stressed in the long term is generally bad for our physical health and our psychological health. So I'll put that down on the list there, Joanne. And this might feel like I'm asking you just the same questions again, but just humour me. What would be the upsides of stopping gambling for you? Oh, sorry. What would be the downsides of stopping for you? Do you think? Because I know that's been on your mind. Should I stop?
Yeah. So the downsides of stopping, well, look, it's a bit of fun. It's I've got friends that play the pokies with me, so I wouldn't be able to see them.
So you might miss out on something that you really enjoy and that feels social.
Yeah.
Anything else?
Downsides of stopping. You know, when I'm playing the pokies, I everything falls away and I don't feel stressed. So you know, would I feel more stressed if I stopped?
Yeah, you might. Well, I guess you might think that you might feel quite stressed because at the moment that is one of your coping strategies, really, and it does give you that feeling that you're not being stressed. Of course, that feeling doesn't last, but it does certainly feel like that. And some people say that they might feel very bored, or they might be irritable or have low mood if they stopped gambling as well.
Well, I know on the days when I'm not working and I'm trying not to go to play the pokies down the pub, that's hard. You know, I do feel irritable and antsy and can't settle at other things.
Okay. All right. That's good to know. Thank you. I mean, oftentimes that's actually a withdrawal from gambling, but you know, we'll speak more about that later on. We'll just continue with this at the moment. What about in the long term? What would you think the downsides? Are there any downsides that you can
in the
think
long
of
term?
About changing?
Look, in reality, no. There's still this little part of my brain that's going, but you'll win the big one. But in reality,
that little thing, that little part of your brain that says that hope springs eternal, you know, so you'd be waving goodbye to the chance of winning.
Yeah, totally. And look, I've certainly been in the club when people have won big amounts of money. You know, and so that possibly could be me, but then the rest of me goes, no, Joanne, really, it ain't going to
What would happen really if you did win? Yeah, and thinking that through is important too.
Yeah.
So what about the positives then of making that change? How would your life be without the gambling in the short and long term?
We'd definitely have more money.
You'd have more money, okay.
Yeah, Clark and I would have to find something else to argue about. You know,
well, you may argue less, may I?
Exactly. No, look, we get on really well. Other than this is just a bit of a, you know. So look, we'd get on better. He'd be happier. I think I'd feel better. I think in the long term, I think I'd be happier. And my mum, my mum's, you know, she goes down the OSL, but she doesn't gamble, and she's seen me, and look, she would be really pleased as well.
Oh, okay. Well, thank you. Thank you, Joanne, for describing all of that. Some things can feel like they're quite out of reach, but it can be tricky to describe all of those different aspects. And you've really said to me that you would probably be happier if you stepped away from gambling, for example, and you would have more money and potentially less or different arguments with Clark. So that's important. I think sort of out of those, what do you think, if you were to entertain the possibility of changing, what do you think your best reasons would be for making that change? Because change is so hard. We need good reasons for why we would want to do that, go down that path.
Well, look, I hadn't really thought it through in the way that we've just done it. It kind of whizzes around in your head and then you run away from it.
Mm.
So it's really good to think through it. And when I think about it, really, it's my family, it's my mum, it's Clark, it's the kids. You know, I realise that I'm not really available very much. I'm not there, and I want to be. You know, and look, my dad died in his early 50s, and goodness, you know, we don't know how long we're going to live, and I want this to be different.
Wow, yeah, I think that's really important, that you want to be present. You know, life is short, and as you've said, you like to not have so much of your focus in your headspace taken up by something like this. You want to be able to support your family, so that's really important. So given that, then, Joanne, and I guess I'm skipping a few steps here, but how ready do you think you are to make that change? Say out of 10, if 10 is I'm absolutely ready and 1 is I want to stay the same.
Yeah, I guess what I'm thinking, Dr. Kate, is I don't know how to do this. I'm not sure I've got the skills. You know, so I'm thinking, look, I want to do this for my family, but what do I do and how do I do it?
Yeah, it can seem intimidating, and we'll certainly talk, Joanne, about a few things that you could do, and we want to make them things that you really feel that you can achieve. You know, small steps that can see your way. So, for example, if you're feeling ready, you might wish to limit the amount of money you carry on you, so that if you do happen to slip, then perhaps, you know, it's not creating that level of stress for you, for example. But you've mentioned some really important reasons there. So how ready do you feel, if you were to give a number to just how you feel right now?
A number for how ready I am?
Yeah, how ready you are. So if 10 out of 10 is I'm absolutely so ready, I know you're saying to me, I just don't know how to take the steps. What number would you give
when
yourself?
I think about my family and I think about not wanting to do this in 10 years' time, 7 or 8, I think.
Oh, that's quite high. Well done. What makes it not a 4 or a 5 or a 1 or a 2, for instance?
Because I've been sitting in the 1 or 2 for a long time, and I'm fed up with it. And I look to the future, and I think, I don't want to do this. I've got to do this differently. I want this to be different. I want to stop this. I don't want to waste my time. I don't want to waste my life.
Oh, I think that's very important, very valuable information. So let's talk about how to do that. I suppose as part of that, I'm curious as to what might stand in your way, because you're sounding very strong. You really want to take these steps. And that's really admirable, Joanne, that you want to be there for your family and support your family. I think it's so important that we work together on this. I'm just wondering what might trip you up on that path, if anything.
The sound of the pokies.
Yeah, it's very compelling.
Lights. Oh my God, you know, and going into the club, and I work in the club. I've got the pub just around the corner, and
so you're in that environment. So I don't know, then I guess just stepping out of role play for a minute, you're now sounding like you might be in action. So I guess we could talk about pragmatic steps here. But essentially what I want to ask you as part of the rest of it is, what do you think you'll do after the consultation? But it can be hard with a patient who really doesn't know the steps to take. So we'd be moving into action.
So Kate, I'm just thinking, and this is coming out of role play, you've got somebody that says, look, this is important. I want to change this, but I don't know how to do it. So that's about building confidence, isn't it?
That's right. Yeah. And some ways to do that, you could point to other things in their life that they've made changes about. It could be as simple as cheerleading, but it does need to be, of course, genuine. And you want to make those goals, smart goals, but specific and measurable and achievable for the patient. Something that they feel as though they can actually achieve, and then building self-efficacy through experiencing themselves doing these steps and getting there in time. And hopefully, I mean, it sounds like Joanne and her GP had a good enough rapport that Joanne was able to bring this conversation to her. hopefully those consultations can continue, because I think that level of accountability can also really help. And being able to say to your GP, I did it, is very powerful.
Yeah, totally. Look, I've just got a question from Kirthi, who said, does motivational interviewing increase the likelihood of Joanne changing her behaviour? Is it actually effective? Is, I think, what he's asking.
Oh, absolutely. Yes, it is very effective, specifically for these instances where it's long-standing chronic behavioural patterns, where there can be a lot of ambivalence experienced. So I think it has most evidence in things like addictions, actually, but also other types of behavioural change like medication adherence, diabetes management, exercise, eating, behavior change is so important for health outcomes, isn't it?
Yeah, absolutely. So look, I wanted to give some feedback, and I think we've done about 15 minutes, which is around about a GP consult. And I certainly feel like we've covered a lot in that time. But as the patient, I felt very understood, very supported, was very non-judgmental, which is really, really important. And I didn't feel like you were pushing me beyond where I was ready. We were dancing that dance together, which is something that you spoke about before. You've got to walk alongside rather than be ahead or be behind. And I do, look, as a human being, I don't have a gambling issue, but all of us have ambivalence in our lives. And certainly what I saw through that was that, that how useful it is to look at short-term, what's good, what's not so good, long-term, and how different they are, but also breaking it down into continuing the behavior or changing the behavior and how they're subtly different. And so my character as Joanne, once again, it really helped her to dig down into what is core in my values for me as my family, and being there for my family. And so that was a kind of a realization that she came to, that at the beginning of the role play, I hadn't had in mind. So it really, and I think one of the things that can happen for us in general practice is we think, oh my God, this is going to take forever. But doing this work early on means that people move on, and you're not chasing your tail and people pushing back and saying, get out of my face, doc, because you're having a conversation which is engaging with what's important to them.
Yeah, I think that's really the essence of motivational interviewing and what it is. I mean, gosh, GP consultations are short, but we have usually 50 minutes with the client, so it feels a little different. Ordinarily, I'd be doing a bit more summary and a bit more reflection for the person, and helping them to take some steps then. But these are the meaningful conversations that people have not necessarily had the opportunity to have.
And look, the other thing for us, which perhaps is a little bit different for you, Kate, is that we see people long term. So we can have a little bit of this conversation and then come back to it the next time. We can do it over a series of consults, and the person has time between hand to kind of think things through. And so we don't need to do it all in 15 minutes. And understand that, I think the role of cheerleading and yay, you can do it is really important. But before that comes, I really want to understand, I'm really curious about what's happening for you and how I can support you to make the changes that you want to make. Yeah. So just coming back to Joanne for a moment, we've got a few minutes before we want to move on to the Q&A. So at the moment, what she's saying is, I don't know what I would do. What are some of the tips and tricks you would offer, Joanne? I mean, you talked about not taking as much money. What else could we offer?
I suppose for context, I work in a voluntary, I suppose, people who are coming along for treatment of their problem gambling. So I see only problem gamblers. They could be at different stages of change though. So ordinarily for somebody who is coming along for treatment, their harms are severe enough that we're really wanting to work towards ambivalence and work towards abstinence for problem gambling. And so no gambling. And if they would like to keep some aspect of the gambling, I'm giving them some psychoeducation about how that's very difficult to do, to control your gambling after you've had a problem with it. So for somebody like Joanne, probably her harms are severe enough that if she wants to completely have no gambling, I would want to be really clarifying, what are we working towards here? Say you came along to see me a few times and we're really successful. What does your life look like? So clarifying that, number one. If she says no gambling, then we're looking at all those different areas that she spoke about. So when is she gambling? What to do instead if she was going to be managing that? We're wanting to set her up for success so that she's not experiencing really strong urges. And that could be carrying less money. It could be banning yourself from venues, or choosing a new place to take your mum to, or she mentioned that she took her mum to that RSL. So some really practical, pragmatic things. Oftentimes in gambling treatment, we're talking about money, because money is the lifeblood of gambling. So we're looking at perhaps letting her partner know, her husband know what she intends to do, and having him perhaps managing the family finances for a brief period of time. But it really depends on the circumstance there. Does that answer your question?
Yeah. So I'm just thinking, so for us, if we've got someone that says, oh, look, yes, I really do need to change this. The focus is, I think, on helping them to think about how they might limit their exposure to gambling and the amount of money they spend. The other thing that you flagged before is the relationship with the partner, and how that's an issue, and maybe that needs some support.
That's right. So you want to be wondering together about, does he gamble with her? What would his opinion be if he was here? Maybe having him have some support as well. But certainly relationships and trust between particularly partners, but anyone, parent and child, or anybody, can really be eroded by any kind of addiction, particularly gambling, because money is a very stressful source of arguments for people running a household.
Yeah, the other thing that Joanne mentioned was that she felt ashamed, and her mother had this experience of having a partner who gambled. And I guess I'm just kind of thinking about that shame, that secret, that as with the lie bet test, if you ever lied, and it is that stuff around, oh God, I'm spending the money when I shouldn't be. What is the role of family supports or social supports in helping someone like Joanne?
I think scaffolding to meet her goals is really important. That can often include telling others, but it might not. Actually, that's one of the symptoms of having a gambling problem, is hiding, as you just mentioned, hiding your gambling. And so being able to have a conversation with somebody like your GP is an active step away from that shame and stigma, I suppose. We often have this idea, I think, as clinicians and everybody, that gambling addiction, because you're not ingesting something, it's less risky, but it is in fact quite a risky addiction, where people are often having suicidal ideation and can see no way out. So we want patients to understand that this is something that to take seriously, and also that it's not a moral failing or a flaw, that it's actually an addiction where we can see that there's increasing tolerance and withdrawal profiles and what's going on in their brain. So that's part of the CBT treatment, is psychoeducation about, for example, how pokie machines work. That can be very valuable information for.
So how do they work? Tell us.
Am I fitting in this into 5 minutes? Essentially, for Joanne, she will have that experience in her life that, if she does win, the gambler's fallacy is a sort of a irrational thought that is prevalent in gambling, and we're all vulnerable to this, and it's that I can predict the outcome of random events. So you'll see patterns in a pokie machine when it's nearly there or nearly about to pay out, and in fact it's a random number generator. And the other thing that often comes into play is the gambler's conceit, we call it, which is, not only will I win, but when I do win, I will be able to walk away. And Joanne had that she just needed that big win, then she'd pay off all her debts, and or she had sort of a version of that, I think. So we really want patients to really evaluate that based on their own experience. What does happen when you win? And oftentimes it is that the money goes right back in the next time.
Yeah. So look, I am aware of the time. I'm just encouraging people attending the webinar to put their details in the Q&A. We really want to engage in any, have discussion about things that you're interested in. Just remind you that Gamble Aware. Now, this is the New South Wales Gamble Aware. We are in New South Wales, and this is a New South Wales focused webinar, but there may well be attendees from other states, and there are Gamble Aware providers around Australia. So importantly, they offer free, confidential gambling support and treatment for people over the age of 18 or their families if you've got a family member who's gambling and the family member needs support. And they do online and face-to-face. So they're all around Australia. You can just look them up on the web. But yeah, sorry, Kate, I should come back to you and say, tell us a little bit about what your Gambling Aware organisation in Sydney offers.
So we offer, I think this is probably true for most Gamble Aware services throughout New South Wales. It sort of follows along LHD lines. So we run a service out of St Vincent's Hospital, based in St Vincent's Hospital here in Sydney. And we offer face-to-face and telehealth consultations, specialist in treating people with gambling disorder, but also supporting people whose loved one perhaps has a difficulty with gambling as well. CBT treatment with motivational interviewing is sort of the gold standard treatment for adults with gambling problems, and the more family-based treatments are also offered. We also have financial counsellors, which is something that's often really important in gambling problems, and Aboriginal specific support as well.
Fantastic. And so for me as a GP, if I've just seen Joanne and we've had that conversation, you know, I can encourage her to attend Gamble Aware, or I can refer her. Is there a chance for us to kind of work collaboratively, given that I know Joanne very well and I've seen her over some time?
Absolutely. I mean, it's not exactly the same as the Medicare system where we would be communicating through a letter, but certainly a warm referral like that is really appropriate, or Joanne can call up herself and self-refer too.
Yeah, and look, and I think
provide feedback to you as well.
Yeah, look, that's great. I think it's, you know, it's one of the things, don't underestimate for us as GPs the role that we can play in supporting people to start down this journey. And as you said, Kate, it can be, people can feel really shamed and it's a secret that they need to hide. And so it's a big step actually disclosing. And people quite often won't mention it. People don't often present to their general practitioner saying, I have a gambling issue. We do need to ask. And we are trusted by our patients. Our patients, you know, they're uncomfortable about it and they feel bad about it, but, you know, they're more often than not, and this is certainly in terms of the conversations I've had with people with lived experience of gambling is, you know, when I raise that issue, it's like, oh, thank God, you know, somebody's asking me about it. And it's okay to ask about it.
GPs are in such a valuable position. I think you're absolutely right, Hester. You know, I see people who are self-referring. It's a tiny proportion of people who have a gambling problem. And actually the evidence suggests that a lot of people can self-manage and cut down and stop their gambling. But the GP is such a valuable resource, you know, such a trusted space in which to bring this. So, you know, GPs will, whether or not you know, if you have seen somebody with a gambling problem, we certainly have. And I would love it if people are asking the question.
Yeah. And sometimes it's just one short conversation is enough for people to go, oh, you know what? Yeah, this is, I'm not happy with this. You know, people make this change on their own, you know, and flagging that, having that conversation, expressing concern is really core to people kind of shifting that, you know, and we are as a concerned, trusted health professional, we're really important in that process. And if it is just, hey, look, I'm concerned, don't have a lot of experience in this area, I'd love to refer you on to the experts, that's terrific. If you want to do it with a patient that you know well and you can do motivational interviewing, use some of the techniques and tools that Kate and I have discussed tonight, then go for it. And you can do it over time. Do come back and check how people are going, because, you know, what we know with the stages of change is that people can slip back into old habits. You know, how's that going for you? You know, do you need more support? You know, and it's
tricky as well, Hester, sorry.
Yeah.
But I'm just aware as we're talking that, you know, I work in the middle of Sydney. It's a place where there's a lot of resources for people. But if you're working regionally and rurally, sometimes it can be tricky to find that person to refer to. There will be a Gamble Aware service that covers your region. There might be counsellors there that provide telehealth, or people spend a lot of time in the car going to visit, you know, various various gambling people with gambling problems throughout that region.
Mm.
So there will be that support and that resource there for GPs that are in less resourced areas.
I'm just thinking about, and certainly with Joanne, she was presenting with low mood, and you were talking about people becoming suicidal because they feel so stuck. What would you suggest, that GPs can do in terms of somebody that, is presenting with mental health issues, asking about gambling, but how do they manage the two of them in the short space of time we've got? That comorbidity of a gambling issue and mental health issues of depression.
Oh, absolutely. Well, I mean, I think gambling is a mental health issue personally, but for sure, and that's often part of the presentation, as you just mentioned. So I think don't underestimate the power of having the conversation, and the person being able to voice that to you is actually very protective. So them saying, look, I'm really feeling on the edge here, and you having an empathic response to that. Sometimes it can be tricky to know what to do, but I'm hoping that from this information today, you're able to see that gambling is a very treatable condition. This is something that can improve. Even when you're in it, you might not feel like it can get better, or you can feel very, very stuck. But actually, we see people every day who are, in terrible situations, or feel as though they can't make a change, and they absolutely can do that. So helping you to have the confidence to reassure your patients of that can be quite protective. Obviously, if you're thinking there's really high risk here, then you'd be following that risk management route, where it might be presenting to your local emergency department and things like that. But I think, not losing sight of what's led them to that point is often something that we can discount. Oh, that's just a behaviour. Whereas actually the gambling is the often the damaging thing.
Yeah. So changing that behaviour can improve mental health.
Absolutely.
Yeah.
And it does. No end.
Yeah, fantastic. And the other thing I think that's really lovely about what you've said is that ability to instill that sense of hope. And so that you've worked in this area for some time, you've seen the changes that people can make. So we can, as GPs, give that real sense of hope. You can change this. People do change this, and life will improve.
I think it's really important, because imagine if you saw, 4 Joannes in a row, how would you feel as the GP that day? You'd think, oh, this is really a scourge, and I don't know if I can help these people. But in actual fact, people do change. And when they do, their life can change dramatically. So sometimes that assessment, you'll think, there is actually a mood disorder here that the gambling is sort of on top, secondary to. Other times you'll be thinking, this is gambling. Gambling is very stressful. It can make people feel very down or very, very anxious, because they're constantly trying to put out fires. Financial fires, relationship fires, whatever it is. So I think it's really great that we're having these types of conversations, and it's on people's radar to ask it.
And the other thing you said before was just that thing of, with a patient, looking at what they've achieved, their past successes. So for Joanne, having conversations around what actually are the skills that you have that you can cross apply from elsewhere in your life. What kind of things would you talk to a patient about those?
Well, I think everyone has the experience of being ambivalent about something, but everyone has also had the experience of making difficult steps where it's been necessary before. It can be quite a different thing when someone has an addiction, because part of them will be very compellingly telling them that they want to keep it. So I think for somebody like Joanne, really harking back to what's really important to her, how she wants to not only do the best for her family, but also to mitigate some of the risks of continuing to gamble. And if you see Joanne over time and you know her well, thinking about what strengths she has and keeping them front and center. And that can be particularly important when someone's in relapse, because they will be feeling pretty low. And you and I and everybody knows that progress is not smooth sailing. They might have taken a trip, but doesn't necessarily mean that they've fallen back into a full-on tumble and forgotten everything that they've learned. So
though it can feel like that, can't it?
It can feel like that, yeah, which is why
God, here I am again.
The GPs, so that you can that hopefully reflect that back to their patients, that you can feel like you're back at square one, and you're absolutely not. But progress, you've practiced gambling so much, it can take a long time to train yourself back out of it, but it's very worth it.
And I guess the other thing would be perhaps flagging with someone who's shifted that behaviour, to just flag, look, it might rear its head again. It might be at a time in your life when you're a bit stressed or whatever, but just be aware that, you know, we come back and see me, and we can do a little booster. We can have a little chat. You know, so
I love that. Yeah, for maintenance, the number one thing we see is people thinking that used to be a problem for me. I feel complacent about it. It's no big deal if I just put $50 in. What's the problem? And so that's one of the main things that leads to another slip. So as well as feeling very good about something, having a windfall of money, feeling very stressed about a life change. So I think it's really good to keep it on the radar.
Yeah,
absolutely.
Yeah. Fantastic. So we've got to finish up. We've got a few useful links there. So these you mentioned before are some handbooks, the Motivational Interviewing 10 Strategies for Breaking Change Talk, Enhancing Motivation. These will all be available to you after the webinar. So look, it is 8 o'clock. I want to finish on time. I want to thank everybody for coming along and for the questions that you guys put in the chat. And most importantly, Dr. Kate, thank you so much. That was really, really fantastic. I learned a lot tonight, and you did a great job. And Joanne is going out there now to change her gambling.
Good for her. Well done, her. Thank you very much.
Good night, everybody.